So good afternoon, myself Dr. Pulkit and I'm working as a medical oncologist at Apex Hospital, Malvinagar, Jaipur. So today we are going to discuss a very important but yet a neglected topic by the name of esophageal cancer. So esophageal cancer means is the cancer of esophagus. So what exactly is esophagus? Esophagus is basically a food pipe which carries the food from mouth to the stomach. So if any of the cancerous lesion develop in the lining of esophagus, it finally leads to esophageal cancer. Now, the problem lies that esophageal cancer is basically diagnosed at a later stage and not in the early stage, because there has been some problem in seeing the symptoms at an early stage and patients often not seeing the doctors at the early symptoms. So what are the early symptoms of esophageal cancer? So one of the most important early symptom is difficulty in swallowing of food. It may start with difficulty in swallowing of solid food, that is eating the chapatis or the breads or the normal stuff, and it may progress to even difficulty in swallowing of liquids. This is how the disease progress. So whenever there is an earlier symptom of esophagus cancer, every patient should refer to the nearby physician or oncologist. Now, what are the basic causes of esophageal cancer? So there are basically two types of esophageal cancer. One is squamous cell carcinoma, which is the most common, and another is adenocarcinoma. So squamous cell carcinoma is basically linked to the habits of smoking, alcohol consumption are the two major risk factors. So patient who smokes a lot is basically most importantly diagnosed with squamous cell carcinoma esophagus, and if they are drinkers, the add-on factors leads to the more lethality of squamous cell carcinoma esophagus. The other is the adenocarcinoma esophagus. So the adenocarcinoma esophagus is basically related to the bad diet, very hot beverages, very hot and spicy food, which basically leads to the acid reflux, and this acid reflux may convert into the adenocarcinoma esophagus. Patients who are obese and have nutritionally compromised, eats less fruits and vegetables, are also prone to develop adenocarcinoma of esophagus. So these are the basically two important type of esophageal cancer, squamous cell carcinoma and adenocarcinoma. So alcohol and tobacco are directly proportionally linked to the causing of squamous cell carcinoma esophagus. Now, esophageal cancer are mostly diagnosed at the median age of 40. It may go diagnosed at 50 and 60 years of age also. But nowadays, the trend is being seen that the esophageal cancer is diagnosed at an early stage also. This may be because of the alteration of the microbiota, some of the effects of environmental pollution also. So nowadays, I am seeing the esophageal carcinoma in early stages also. Because of excessive smoking and drinking habits, esophageal carcinoma is basically diagnosed more in males as compared to the females. So that's why the link of tobacco chewing and alcohol is directly proportional to the esophageal cancer. Now, how do we diagnose the esophageal cancer? So we do an investigation by the name we call as upper GI endoscopy, in which there is a scope of camera. We put the camera through mouth in the food pipe, and that camera will detect any kind of precancerous lesion in the lining of esophagus. If there is abnormality detected, we would take a biopsy through endoscopy, and if this biopsy comes out to be positive, this is finally leads to esophageal cancer. So upper GI endoscopy is the primary investigation of choice to diagnose the esophageal cancer. So once the esophageal cancer is confirmed, we need to do the staging of the disease. That is, the staging means whether the disease is up to the esophagus or it has spread to the other organs. So we do some scans like CT scan, we can do PET scan to see whether the disease has spread anywhere in the body or not. And why this is so important? Because the scans will tell you the staging of the disease, whether disease is early stage, locally advanced stage, or in stage 4. So if it's in the early stage, then immediate surgery can be a curative option for the patient, and that will increase the life of the patient to much higher extent. If the disease in a locally advanced state, then we can give initially chemotherapy or combination of chemotherapy and radiotherapy, and then further can go ahead with the surgery. So this is also a curative intent. But if the disease is diagnosed in stage 4, that is the disease has spread to liver, lung and other parts of the body, then the palliative chemotherapy remains, or the immunotherapy and target therapy are the basic options we give in stage 4 esophageal cancer. So that's why I have said earlier that the early diagnosis of esophageal cancer is very important, because if we can able to diagnose the disease at early stage, then we can have the treatment from curative intent. So that will be increase the lifespan of the patient, because the difference of lifespan of a patient of early stage and stage 4 is pretty. So the early diagnosis of symptoms of esophageal cancer is very important. So nowadays, from the treatment point of view, we have chemotherapy available. We have newer molecular drugs like immunotherapy and target therapy, which when added to chemotherapy has increases the survival to a much higher extent, to which patient can also tolerate through a longer time, because chemotherapy has its own side effects. But if immunotherapy adds to chemotherapy, then the side effects become really less and patient can take the drug for a very long time. So I would like to say that since we have discussed the causes of esophageal cancer, various investigations required to diagnose esophageal cancer, and what are the early symptoms and signs. If I talk about the late symptoms and signs, then the dysphagia to the solid food, dysphagia to the liquid food, and finally there can be blood in the vomit, there can be difficulty in breathing if the disease has spread to the lungs, there can be decreased appetite, there can be ascites, that is the filling of fluid in the stomach. These are also the future complications of advanced stage disease. So the important factors to prevent happening of esophageal cancer is to avoid smoking and tobacco, to maintain the diet, maintain the healthy lifestyle, to avoid adenocarcinoma esophagus, as we have discussed that obesity, acid reflux are one of the important cause. So avoiding the very high spicy food, hot beverages is also can help you to reduce the risk of developing of esophageal cancer. So through this interview, I would like to request all my viewers to kindly avoid smoking, to kindly avoid tobacco consumption, to kindly avoid the alcohol consumption, maintain a healthy lifestyle, because as the older dictum says, prevention is better than cure. So as a medical oncologist, myself Dr. Pulkit wish you a lot of luck, and I hope this informative interview will help you to understand that what are the early symptoms and signs of esophageal cancer, so that you can refer to and go to your nearest physician as early as possible and can be prevented and treated from this dreadful disease at an early stage. Thank you so much.